Today I'm going to tell you about the different breakthroughs that are going on between the understanding, assessing, and treating gender identity disorder. It's thought that gender identity disorder happens or starts at birth. Research is being conducted when it comes to understanding the development of gender identity disorder. It's known that the chromosomes actually determine the sex of the baby. And then there's different hormones that go to the brain when it's developing. Certain hormones, when they're present, will help the brain develop male, and when they're not present, it will develop female. One of these hormones is called androgen, and it's thought that this is used for the structural differentiation between a male and a female in the neurological tissues. However, this process of this hormone developing in the brain can be deviated or interrupted. Different things that cause this to be interrupted might be maternal stress, environmental toxins, malnutrition, radiation, drugs. There's many different things that can cause this to actually interrupt and make the brain develop in a different way. We can actually see this in physical deformities as well as any mental inhibition. And these are very predominant, whereas because gender identity disorder and the development of the brain is such a milder form, it's not as easily detected, so it makes it a little bit harder to understand exactly how the brain develops and helps understand the development of gender identity disorder. When it comes to assessing the disorder, they are doing studies, and it's demonstrated that male and female brains have an actual difference in chromosomal structure. Different UCLA scientists say that their findings and the differences in the brain can demonstrate gender dysphoria as an actual biological characteristic. So the differences in the brain and how they're developed, this can actually be seen and used to help assess any different gender dysphoria that a person may experience when it comes to their gender identity disorder. However, because this is so new, it's a lot harder to assess somebody with certainty because there's not as much research out there in order to make this completely valid or anything like that. So more research has to be done in order for this to help in the assessment, but it's definitely in the works. When it comes to the treatment of gender identity disorder, there's different breakthroughs that have happened. It's not known exactly when to allow a person to undergo reassignment surgery. They normally wait until an individual is an adult. So normally about 18, they can actually decide whether or not they want to undergo a reassignment surgery. But by this time, many people have gone through, their development in adolescence, and so they're kind of behind the curve a little bit, and this may cause different psychological and social issues later on in life. And so they actually have two different interventions that they can allow adolescents to use. One is a partially reversible intervention, and one is a fully reversible intervention. The fully reversible intervention undergoes a GnRH treatment, and what this does is this suppresses puberty in the individual for a small amount of time. This makes it so that the person isn't going through their normal puberty stages as the sex that they feel that they're not. There's also the partially reversible intervention. They undergo the GnRHA treatment, but they'll also undergo cross-sex hormones. So they will have their puberty stopped in the sex in which they are physically, and then they will have hormones induced into them that will create the puberty of the actual opposite sex, so that they are kind of in that little bit of transformation. This will allow them to be able to grow as that sex and be able to be a little bit more comfortable. They'll be able to understand their body, what it's going to be going through, and all of that kind of stuff. So this actually enables an individual to be able to go through the transformation just like anybody else at their age. And then when it comes time for their sexual reassignment surgery, it's normally actually a little bit more of a positive experience. It doesn't hinder them socially, it doesn't hinder them psychologically. It's actually known that adolescents that go through this and then undergo their reassignment surgery, they're happier, whereas adults that don't go through this and as an adult they go through the reassignment surgery, it tends to have a more negative effect for them. So there's many different breakthroughs that are coming through. However, they're actually working on changing or contemplating changing the DSM when it comes to gender identity disorder. Should they take it out? Should they word it differently? It's just, there's so many different issues with it right now, and so they're determining whether or not they want to change that or not. And so as more and more research goes on, it'll be able to be even better understood in the development and better understood in how to assess, is a person feeling the dysmorphia or anything, dysphoria or anything like that, and then fully be able to help the individual overcome everything and learn how to cope and really work through everything. So I think that there will be many more breakthroughs in the future.